Good day. My name is April Claire Cintina, and for today I will be performing an abdomen assessment. So before going to the procedures, we are going to provide privacy to our client, wash our hands, and explain what we are going to do. And the equipment that we are going to use is our stethoscope. So let's get started. First, we are going to inspect the abdomen. We are going to observe the coloration of the skin, and it is normal for the abdominal skin to be paler than the general skin because it is less exposed. And we are also going to note for any stretch marks and inspect for scars, lesions, and rashes. We are also going to inspect the umbilicus. Now, it should be similar to surrounding abdominal skin tones, or it should be pinkish, and it should be located at the midline, at lateral. And the contour of the umbilicus should be either inverted or protruding no more than 0.5 centimeters, and it should be round. And also, we are going to inspect the abdominal contour of our patient. So, our patient here has a flat stomach. So, it is also normal to have a rounded stomach or scaphoid. Protuberant, which is usually abnormal, and it should be, if it's round, it should be evenly rounded. Abdominal movement may be seen as the client breathes, especially in male. Also, we are going to observe the aortic pulsation. Next, we are going to auscultate the abdomen. We auscultate first before palpating because the bowel sounds will change as we palpate, so we wouldn't be getting the accurate auscultation. We are going to auscultate for the bowel sounds using the diaphragm of the stethoscope. So we are going to begin at the right lower quadrant and counterclockwise to the right upper quadrant, and then to the left upper quadrant, and then to the left lower quadrant. Then we are going to confirm the vowel sounds in each quadrant, and we are going to listen for up to 5 minutes to confirm the absence of vowel sounds. So a series of intermittent soft clicks and gurgles are heard at a rate of 5 to 30 per minute. So, vowel sounds normally occur every 5 to 15 seconds. Then next is we are going to auscultate for vascular sounds. So, using the bell of our stethoscope. So, we are going to listen for bruits over the aorta, the renal, the iliac, and the femoral arteries. So, brutes wasn't heard. Next, we are going to percuss the abdomen for tone. So, I am going to lightly and systematically percuss all the quadrants. So, generalized, tympani predominates over the abdomen because of the air in the stomach and in the intestine. Next, we are going to percuss the abdomen for tone. So, I am going to lightly and systematically percuss all the quadrants. So, generalized, tympani predominates over the abdomen because of the air in the stomach and in the intestine. We are going to percuss the liver span by determining its lower and upper borders. So, to assess the lower border, we are going to begin percussing at the right lower quadrant. And then, it should be at the mid-clavicular line. And we are going to percuss upward. Oh, starting from here. So, we are going to note from tympani to dullness. Okay. And we are going to mark the point. Next, we are going to assess the upper border. We are going to percuss over the right chest at the mid-clavicular line and then percuss downward. So, we are also going to change from resonance to dullness. We are also going to mark the point. And after that, we are going to measure the distance between the two marks. So, the normal liver span at the mid-clavicular line is 6 to 12 centimeters. So, we have here 6 centimeters. So, it is normal. The liver span at the mid-clavicular line is greater in men and in taller clients. Then, we are going to repeat the percussion of the liver at the mid-sternal line. So, the normal liver span at the mid-sternal line is 4 to 8 centimeters. So, we are going to do the same. And then measure again the two marks. So, okay, it is normal since it is 4 centimeters. Next, we are going to percuss the spleen. So, we are going to begin percussing at the posterior of the left mid-axillary line. And we are going to percuss downward. So, we are also going to note the change from lung resonance to splenic dullness. is an oval area of dullness. Approximately, it is 7 centimeters wide near the 10th rib, and it is slightly posterior to the mid-axillary line. Then we are going to perform blunt percussion on the liver and on the kidneys to assess for tenderness in areas which are difficult to palpate. So we are going to put our hand and then we're going to percuss. So there shouldn't be no tenderness or pain elicited. Now we are going to palpate the abdomen by performing light and deep palpation. So light palpation is used to identify areas for tenderness, and we are going to compress to a depth of 1 centimeter in a dipping motion. So, sir, just tell me if you feel any pain, huh? So, we are just going to gently lift our fingers to the other side. Okay. So, now we are going to perform the deep palpation. So, we are going to deeply palpate all the quadrants to delineate abdominal organs and detect subtle masses. So, we can use both hands if you need more strength. So, okay. We are going to compress to a maximum of 5 to 6 centimeters. So, sir, just tell me if you feel any pain. So, it is normal to have mild tenderness over the xiphoid process, aorta, cecum, sigmoid colon, and ovaries.